In this live, you'll be hearing questions and answers for a Band 5 interview in the NHS. This is specifically centered on a mental health nurse questions and answer based on an interview where I sat on the panel. I have the questions on my laptop and the answers where I'll be going through each question and answer for you to be able to understand how best to answer those questions. This live recording or this recording will be put on my live stream where you can watch it to be able to go back to it and refer to it based on questions and answers that have been asked. So if you want to watch and want to learn in terms of questions and answers that will be asked for a Band 5, please come on and watch this video. I'll be reading from my laptop because this is a different kind of recording, so I can get all the facts and figures for you to be able to know how best to answer those questions. So we'll be looking at it in terms of how best to answer questions. Just a quick introduction. My name is Temi. I'm an HR professional with over 20 years experience working in HR, and I have over 10 years experience working in the NHS. I've had roles from recruitment to employee relations to generalist HR. So I know one thing or two about trying to get a job in the NHS. In this video, we'll be using the STAR method to answer these questions for a Band 5 mental health nurse. So what is the first question that will be asked? What does patient-centered care mean to you? The answer to this question is, to me, patient-centered care means putting the individual at the heart of everything we do. It is about respecting the values, preferences, and choices, and making sure they are fully involved in decisions about their care. In mental health, this means working collaboratively with patients and their family, empowering them in their recovery while also keeping safety and dignity central to the practice. That is a very good way to answer what does patient-centered care mean to you. So you're aware, I'll be reading the answers to these questions from my laptop. So it's not me directly looking at the video, it's just me reading it for you because these are prepared answers that I've prepared for you to be able to get the essence of how best to answer questions and what the interview panel really wants to hear. The second question that would in most cases be asked for a Band 5 mental health nurse is, can you give an example of delivering patient-centered care in practice? The answer to this question using the STAR method is, while working as a healthcare assistant on an acute ward, I supported a patient who was very anxious about attending ward rounds. My task was to help them feel able to have their voice heard. I spent time beforehand listening to their concern, reassured them about the process, and asked them what they wanted the team to know. I offered to sit with them during the meeting and encouraged them to speak when they felt ready. As a result, the patient contributed to their care plan, felt listened to, and became more confident in engaging with the team. Another good example that is centered around patient care. Third question that is centered around dignity and respect and also patient-centered care is, tell us about a time you respected a patient's dignity and privacy. The answer to this question is, on one occasion, a patient became very upset when staff started discussing their care in front of others. I recognized that this compromise